That was noisy. Hello, everybody. So it's not quite time to start yet. It will be in a moment. There's a pad of paper in the back. We talked a little about the idea of either having a Google group or possibly even, video calls where people can share cases, because several of you have come up to me and said things like, well, I have this one stroke patient, but there's nobody around to talk to about whatever, and it would be fun to have those of us who are doing a few stroke cases to talk about them. So I put a pad of paper in the back there. Maybe someone wants to run it up, and then also Angie Hicks is hosting next year. In November 9th and 10th, I'll be doing the whole weekend of this where we can practice on each other and, go into more depth of detail in the material and go more deeply. You'll see, I'll give you the second half of the class will be sort of a breeze through the protocols. There is a 24-page manual that has a little bit of background on some of the stuff we talked through about how stroke happens and how it gets treated and what an acupuncturist needs to know in doing stroke. That's free online anyway. You can just Google my name, but I'm just emailing it to Gavin, and he will also put it up online along with the PowerPoint, which will be available online, and the tape of this in case I said anything too fast and all of that. That'll all be up online safely. But if you want to be on a mailing list, either for that next November weekend or for keeping in touch with others of ourselves, and I have a few others. I have somebody in Holland who's doing stroke. I have people who I've taught in various places at various times who would like to get together and have case conferences. So we could do sort of monthly or something, emails in between, and then maybe some kind of a video call once a month. I think that would be fun. Alrighty. I think there are a few people here now who were not here for the first half. Can I see those hands? People who were here for the first half, would you mind awfully if we did a 2-slide review of the overview of what we do? Okay, I promise we'll try to keep it entertaining and we'll be pretty short. So we've gotten to the point where we're putting it all together. Actually, it's built around a review, so it actually doesn't matter. Here we go. Great. So remember, our first order of business is regulating the cranial qi and blood flow, right? The right amount of qi getting to the head, because it gets just appallingly dysregulated in stroke. The brain itself has this, oh my God, I'm having a stroke reaction, and raises its own blood pressure. And the more you do stroke, the more you can start to understand about when you might want to help the body raise blood pressure, when you might want to help the body lower blood pressure. It's a little advanced for a beginning seminar. Indeed, within my own hospital, two of the neurologists have a disagreement as to how much it's optimal to lower the blood pressure of an ischemic stroke patient. Because imagine you have hypertension, right? Imagine your resting blood pressure is 180 over 120 and you just don't know it, or you go off your meds. A horrifying number of our patients had their strokes at a time when the pharmacy was closed, or they didn't have enough money for their meds, or something, something happened and they went off their meds and then they had their stroke. So if your blood pressure is used to being high and then you have a stroke, you go to the hospital and your blood pressure elevates when you have a stroke. It might be, 180 over 120 or something. But what if it was accustomed to being quite high already? What if 160 is normal for you? You don't want to lower it right back down to 120 over 80, or what'll happen? The blood won't get into your brain, right? What's normal for you matters in terms of settings. So all that to say, there's a lot going on with qi flow to the head. Our basic principle of raising about as much as we lower basically works fine to keep the person relatively healthy, right? So for ischemic stroke, we want to keep the BP high and stable. It's going to look really high to us. That's okay. We're not trying to lower it. GB20 and 21 are extremely powerful to lower blood pressure if you need to do that acutely. But don't get messing around with it while the docs themselves are trying to stabilize the patient on meds. During days 7 to 21, again, you're going to want to do scalp points and descending points, right? Li4, spleen 6, to have an up and down at the same point. Target blood flow to the lesion, so that could be scalp points over the lesion. It could be ear acupressure beads in areas that correspond to the lesion. It could be acupressure on distal points, right, if you can't use needles. But target blood flow to the lesion. Hemorrhagic stroke, if you are doing anything, then it's helping to lower their intracranial pressure, but only if the doctor is saying, good Lord, I don't know what we can do to, you don't really want to get involved. Mainly, you want to wait till they're stabilized. And then it's the same idea, target blood flow to the lesion, gently raise and gently descend. So now we'll talk about specific principles and methods to do this. The way I broke this out, it's because I'm just an OCD spreadsheet person, and the way I understand stuff and know that I have it in my brain is to make spreadsheets of it, and partly is to illustrate to anybody who's interested to what degree acupuncture is a principle-driven, complex, multimodal intervention where for any one thing we want to do, we have a bunch of ways of going about it, some of which involve needles and others of which don't have to, right? So the docs don't have to be frightened of us. And so we have tools to use with our own loved ones. So days 2 to 10, the way that we aggregate our treatment principles, actually it's the same you do in clinical practice, right? The patient comes in, their acute problem is sciatica, but on examination they also have menstrual cramps, dyspepsia, migraine headaches only on damp days, they have a garbage diet, and they don't sleep very well, right? So where do you start? So my rule of thumb is I can treat about 2.5 things in one treatment. Are we about right? Like if it's 2 really gnarly things, or if it's 2 things that are completely unrelated, then probably 2 is plenty. But by and large, you can fit in 2 and part of a third. So you can like multitask points for the headache that also lie along the same channel that the sciatica is on, and then do 20 will help raise it, you can multitask things so that they do multiple things. By and large, you're choosing about 2 treatment principles, 2 to 3 treatment principles per treatment. So with ischemic stroke, their blood pressure and their head intracranial blood pressure needs to stay high and stable because the cells in the penumbra are getting this cytotoxic edema, right? They're not getting enough oxygen. They're making lactic acid. They're also making like inflammatory distress molecules. And then we're right next door to each other, when it's hot and horrible on the tube and you're right next door to other people who are also fussed about being hot and horrible, it makes it all worse, doesn't it? And then if one of the cells dies, it sort of disgorges its bag of messy, unsustainable fluids onto everybody else and just makes it that much worse, So these cells are kind of drowning in their own pee, is how I think of it. So you want to raise the clear and descend the turbid. So do 2024 is an absolute, staple. It's basically, remember that picture? I'll go back to this. So in the Dr. Ju scalp map system, do 20 is the model of the head, is the microsystem of the head. for the back of the body that goes along the back of the head. And then do24 is the microsystem of the head for the microsystem that goes along the front of the body. And that happens all the time in Chinese medicine, that if you want to do something really strongly, you repeat yourself. Use 2 herbs that do more or less the same thing, like Fuling and Baiju, or use 2 points right next to each other, liver 2 and liver 3. You say, no, I really, really want to smooth and cool the liver qi, right? So in this case, we're saying, no, I really, really want you to move the qi to the head. Please really raise the clear yang, right? And in terms of these points' functions, too, do20 raises clear yang in and of itself, and then Shentang, right, do24 is a terrific kind of clarifying point. So it makes perfect sense as a treatment. And in fact, it's not published, but I did a little bit of a study with the neuropsychologist on our unit a few years ago, and we treated some stroke patients and some healthy normals, which I don't know if you can count medical students and residents as healthy normals, but anyway, that's who we did. And we gave them the Wechsler digit span test, which is when you have to repeat numbers back, like 5, if I say 5 numbers to you and you have to say them back to me. And both the stroke patients and the normals did better on it after having these points in. We didn't have enough of them to whatever, it didn't get accepted for the seminar that we wanted to do the thing at. We never bothered publishing it, but anyway, there's a little bit of data that suggests that even just these 2 points alone, I'm not a big fan of protocols, but even just these 2 points raise some clear yang. Then for auricular, you do the master cerebral point, and then on the same side, you locate the lesion on that microsystem of the ear, right? You find the lesion, and it's a picture of the brain. So if you just know where the lesion is, you can find it on the brain. And in here, inside, getting towards your ear canal, are the points inside, deep inside the thalamus, the hypothalamus, the basal ganglia, and then on the outside are the cortex points that we're used to doing from the scalp. Also, of course, the person might need constipation point. They might have zongfu, their kidneys might be weak, their spleen, their liver, whatever zongfu points are great on the ear. So you can do quite a good ear treatment if that's all you can do. Body needles, spleen 6 and PC6 are your key. So if raising the clear is this do 2024, then spleen 6 and PC6 descend. One of the things I did a lot of early in my career was outpatient treatments for, while chemotherapy patients are getting their chemotherapy drip. It's a wonderful time to treat people because what else are they going to do, right? They're a captive audience, and it's great for them to have a chance to talk about their physical experience of their body, which is very intense and going through all kinds of changes. And they used to always like sweet food, but now they only like salty food. And to a Chinese medicine person, that's of interest. Their family and friends are a little tired of hearing about it, and they're a little embarrassed to talk about it. But it's great to have people actually ask them. Anyways, it's a wonderful time to work with people. But I would always do stomach 36 for nausea, because that's what I learned in the books, and that would make them more nauseated. I don't know if just my qi is not very well rooted or something, but I don't have good results with stomach 36 for nausea at all. And I felt very reassured when I talked to Deborah Betts, who's now a beloved colleague, about stomach 36 for hyperemesis in pregnancy, and she said she also had the same thing, that people as often as not would vomit more from it. So if you get good results with stomach 36, you go ahead and use it. I like spleen 6 for descending the qi. So spleen 6 and PC6. And has anyone ever heard of the movie 9,000 Needles? It's a movie about acupuncture for stroke. And it's an American weightlifter who they didn't actually mention in the movie that he was probably taking insane amounts of steroids, but I'm pretty sure that's part of the subplot. So anyway, he has a massive stroke, and his American insurance runs out, as it does. And so he gets on a plane to Tianjin, where this stroke expert called Shi Shuimin is, and does, runs a whole hospital unit where they have acupuncture and herbs and everything else for stroke, and gets quite a bit of recovery. So he actually manages to walk out of the hospital under his own steam, with a quad cane, even though he's had quite a terrible hemorrhagic stroke. Shi Xuemin's first order of business treatment is spleen 6, PC6, and pecking at DO26 until the patient's eyes water. So in an American hospital, I'm a little reluctant to use this one. I absolutely will use it with Chinese patients who are gung-ho and their family are gung-ho. I will use it with patients. I had one patient who he was on a vent. He was kind of, lethargic at best, very minimally conscious. And so we did it until his eyes watered. And then the next day I ran into his doctor in the hallway, and the doctor said, "What did you do? He stuck his tongue out for me on command this morning. He's so much," and indeed, he was kind of chipper the next day and waved hello. So it's really, he still wasn't verbal, he still had a lot of other stuff going on, but it really brought it home to me that this is a very powerful treatment. It's just that, socially you have to. But, a thumbnail in there for a loved one, where your relationship can handle it, say, I know you hate this, but you'll forgive me later, and if they're not verbal, it's probably worth doing. I don't want to be I think I sometimes lack ordinary sensibilities after 15 years of, tragedies, but really you can get try it on yourself. You can get quite a bit of stimulation just by getting a thumbnail kind of 45 degrees up in there. So that's your DO26 pecking, and I will do that if there's dullness, if they don't seem to be, if their eyes sort of meet mine but don't lock in with that I'm alive, you're alive, we're human beings connecting thing. If you don't feel that, I'll use DO26. Or if you want to be a little kinder, palpate along your heart channel. And it's called heart 6, but really it's more around heart 5. It's actually right opposite to PC6. Just with the edge of your nail, palpate up your heart channel, and your finger's going to fall into this kind of nervy cleft right around heart 5. You feel that? It's kind of when you press into it, you get an unpleasant little that. So needle transversely a good ½ inch into that and stimulate strongly. And that's like the luo of what are the luo of the heart? The luo of the heart is like the brain, right? It's the expression of this. So it's like you're scrubbing out the luo of the heart with that. So that's my kinder, gentler DO26. If I don't want to do the DO26, I'll do kind of a scrubbing, strong back and forth needling in heart 6. And then whatever distal points by channel as well for raising the clear, descending the turbid. If you had some other way you learn to do. For example, if the patient's very damp, then DO20 spleen 9 is a great way to raise the chi, raise the clear, descend the turbid. So whatever seems constitutionally relevant to you, feel free to substitute spleen 10, liver 8. And then we talked about opening these window of the sky areas, especially GB 20 and 21, right? As long as you've got chi moving up, it's now safe to open up these areas where the chi moves down, but you wouldn't want to do either half of the treatment without each other. You need the treatment to look like this. So that's ischemic stroke for the first 2 to 10 days, right? I pretty much don't needle anyone until 48 hours after the stroke. I don't mind doing Twina or something, but they're not really medically stable. For the first 2 days, even if it looks on the imaging like it's a clog, it's not entirely uncommon for there to actually be some bleeding behind it, and I just don't want to mess around too much. And also the patient's blood pressure is kind of labile, their temperature can be, until they're kind of medically stabilized, stay off of them. But then for the whole first 2 to 10 days, this is their top priority. So whatever else you work on, also raise, clear, and descend turbid, because there is that big fat mess going on in their brain with the hypoxic cells struggling for breath, right? We had I'm American, but I flew over here to do my PhD, so with my American friends, we had all these jokes about the cells going, I'm not dead yet, I'm hanging on by a thread, like the Monty Python, shut up, you'll be dead in a minute. So there was... Can't breathe it, so you need to do 20, over the lesion, get them some air. Okay, so hemorrhagic stroke. Yeah, so the bleeding should have been stabilized with the intracranial pressure not too high, but it's better not to interfere. But you should know what's going on just in case the case is dire and, I don't know, you're away from medical care or something. With caution, and once you're stabilized, raise and lower. So it's kind of the same principles. But what have I added? I've added spleen 10. Why? Because the one thing we know for sure in hemorrhagic stroke is that there is a mess of dead blood lying around the brain that needs to be cleaned up, right? We know for sure there has been a wet spill in aisle 4. So once the patient is stable, blood will for sure need to be moved. I often use spleen 10 in the ischemic stroke patients as well, but it's more important earlier on in these hemorrhagic strokes where we know for sure there's a big fat mess lying around. And then everything else is pretty the same. Okay, any other questions? Yep, question here and then there, yep. Oh, due to cells in the penumbra. So the shadow, the penumbra is kind of the shadow of the stroke, and that's the area where some cells will live and some cells will die. So if the doctor says, you want to needle my patient, what earthly good do you think that's going to do? I say, well, I think it could shrink the penumbra, right? There are a few kinds of human and animal research models suggest that there may be effects that can lead to helping shrink the penumbra. And they'll go, oh. The penumbra, yeah, it's the injured area where, like, there's here, right behind the clot, are all the cells that are definitely dead immediately, right? Like, there's nothing you can do about the cells that are completely reliant on the vessel that got occluded. But the vasculature of the brain has a lot of redundancy in it for exactly this kind of a reason, right? And so a lot of the areas of the brain can get kind of a backdoor circulation of some air, which is why it's important that the person be as calm as possible, be in a good situation, practice deep breathing, whatever guided meditation you can give them. It's really important to oxygenate those cells well. So I could talk longer, but I won't, about, having them practice deep belly breathing and everything. It's really I'm quite sure we could do so much better for our stroke patients. Yep, question over here.
Yeah, I was just going to ask, is there any benefit or no benefit if somebody's experiencing actually having a stroke to needling the fasciae points on the tips of the fingers?
That's such a good question. Yeah, so right in the moment, if you're with a person and you were to magically know for sure it was a stroke and not just a faint or something else, is there any known benefit? There's not any known benefit, right? Because if they just fainted, the problem is they fainted and the solution is wake them up, right? That's pretty straightforward. But If the problem is they have a blood clot in their brain, stimulating their distal channels in order to arouse consciousness, right? What's happened? They've had the blood clot in the brain and the chi has gone inside in order to do the best it can at salvaging whatever it can salvage. It's not clear to me that waking them up serves them best medically at the moment. But to stimulate, yeah. I would say if there's two issues. One is that it could be ischemic or hemorrhagic, right? If they said to you as they were getting ready to fall, "Oh my God, my head is killing me," that would mean it was likely hemorrhagic, right? That if the patient is, this is actually worth knowing. If somebody complains to you they have the worst headache ever in their life, they have to go to the emergency room. 9 times out of 10, it won't be an aneurysm or a stroke, hemorrhagic stroke that's going to kill them, but 1 out of 10 times it will be. And for God's sake, that 1 out of 10 is worth saving their life, right? Like Natasha Richardson, right? If she had gone to the doctor in time. So if all strokes were ischemic strokes, I would say do 26 on everybody because it increases blood flow to the brain. But if it's a hemorrhagic stroke, I'm not sure I want you to do 26, right? So is it known? No. Do we, like historically, there is this thing about doing the fingertips or doing the Jing wells. So if you feel like it'll help, I don't want to tell you not to, but I definitely do not know of any benefit from it. And that's my concern around that kind of thought. But so we did have a patient who the family really wanted the acupuncture. He was in, medical ICU. He had terminal cancer, but he'd been having a surgery and had a 13-minute seizure. So his brain had been without oxygen for 13 minutes, that's a big injury, right? Chances are he wasn't going to wake up. The family wanted to try everything, so the intensivists called us, and so what did I do? I did exactly what you're saying, which is fingertips, right? And he had quite a strong response on his right middle fingertip, right? His actual pericardium Jing well. And I, noted it. And the next day I came in and they had his right hand restrained because he'd been trying to extubate himself with his right hand. So it did seem as though actually the treatment surfaced him somewhat. A couple more treatments, he was even more arousable. He was kind of moving and responding to stimuli. But then they did a treatment to put in a gastric, a PEG tube, which was against, most medical advice, but the family wanted it. But under that anesthesia, he never really came out from the anesthesia again. So, the good news is that those Sichuan points do work to restore consciousness, but I'm just not sure whether it's the right treatment principle at that moment or not. I just don't know the answer. If you do them and they wake up and they're fine, then maybe it was just a faint. So it's worth trying it if somebody loses consciousness for no good reason, but it might be diabetes and they need sugar, right? If someone goes down and you don't know why, you kind of want to first try to figure out why. Any other questions before we move on? No? Good. Okay. So second principle, which again very often can multitask perfectly well with our first treatment principle, is to restore the function of the chi machine. So again, by the chi machine, I mean what we learned in first year TCM1 of how the food and the fluids go into the stomach, which rots and ripens them, and then the spleen sends them up to the lungs, and the lungs sends them down, right? That whole chi machine may have crud in it, right? And again, the direct comparison is like a hurricane that dumped a bunch of rain, and now everybody's got flood water in their basement, and you might need to clean flood water out of the basement. So phlegm misting the orifices, right? I've got goop like literally I can't get to the surface. I can't connect with you because my heart orifices are misted. Or pretty commonly, you can get aspiration pneumonia. Even if they're not giving you food, you can aspirate your own spit and get aspiration pneumonia, right? And so there's often this just horrible gurgly cough that stroke patients will have. So of course you need to work on that first, because why would you work on healing the arm all the way out here if the how I make my chi is sick, right? If I'm sick in my chi machine, that has to heal first before anything else good can happen. Again, constipation is just epic on the stroke unit. You wouldn't believe the constipation. And then, so people will be on 4 or 5 different, like, you stack up the different mechanisms, right? You have like a stool softener and something that makes, promotes movement, and something that, pushes the food through. I mean, you have all the different mechanisms so they have senna and Dugalax and other stuff. So they can pile up, right? It's often they're medicating. Oh my God, we over-medicated. Let's take a step back. And it's horrible for people to be incontinent. It's like bad enough they can't move. To have an accident is just an awful feeling. So just to keep the person off of that roller coaster as much as possible and to stabilize it. So, it might not be that they're running like a clock, but if they're on 2 or 3 meds instead of 4 or 5, you've done them a huge service, and you've reduced the number of inadvertent over-medications that might happen. And then fecal and urinary incontinence we'll talk about. So those are the main acute messes that I check for. And these are all findable in the chart, right, if you're in a hospital. And identifying and treating the underlying constitutional imbalances, right? Do I still see wind? Usually not, right? I would say like 1 in 40 stroke patients. Sometimes, it's usually the ones who are really badly off will be kind of doing this, right? That's sort of a wind sign. The cogwheeling, they call it. Or sometimes there will be kind of a twitchiness, but it's really not common. How much blood stasis, how much phlegm? So I go by the really gross physical signs, right? So I look for spider veins and horrible flaky skin on the legs. A touch of flaky skin on the legs, we all got that. But with blood stasis, it's really pretty poor. There will be just stasis macules, big fat stasis macules on people's legs. So it's not subtle. And then you can't always get a good look at people's tongues, right? But big dark circles under the eyes. If you can see the tongue, usually when you see the tongue, it's got a coat like 1 inch thick. It's appalling, the tongue coats that stroke patients get. Let's see. Other important blood stasis signs. I think those are the main ones. Versus phlegm. So obviously, if there's visible phlegm. And then the house pulse of the neurology unit is slippery and wiry both, right? And it's got this definite like yucky slippery feel, but then also there's a wiriness to it. And why is that? It's because the phlegm is occluding the flow of chi, right? It is both chi stagnation and stagnated fluids. That is what it is. So it's super common. And so when students come to the unit, I always say to them, well, is the pulse slippery or wiry? And they're like, I don't know, I think it's both. And I'm like, yep, you're right, it is both. All right, so how much blood stasis, how much phlegm? So the phlegm signs, again, you'll see rattly fluid, you'll feel the slipperiness of the pulse, and dizziness, nausea, any of that clues you off. It's a stroke, and also the inch thick tongue coat tells you it's phlegm. And then underlying deficiencies, which, if you're over 30, you have some underlying deficiency, right? Let's be real. The question is it really important? Like, do they have usually if it's a deficiency that caused the stroke, it's either liver, kidney yin, right? That's drying everything up, or Qi deficient people get big fat strokes. They get those hemorrhagic strokes. Yang deficiency, get these kind of wet strokes. The patient's sort of obese. Yin deficient, it's things, the tissue dried up and the blood couldn't move through. So I'm sorry this is kind of small. Can you see it okay? If not, feel free and come forward. So this looks a little scarier than it is. This is all the Qi mechanism stuff. We've got the messes here. This is actually just the messes, and then the next frame is going to be the constitutional imbalances. So let's just start at the beginning here. So bladder and bowel function, remember back to how we grade stroke, the TCM grading of the severity of stroke. So it goes, the worst kind of stroke would be an organ stroke, right? Where you lose consciousness and you lose control of your bowels and bladder. It's a yin organ stroke, and you can't speak. So what organ if you can't speak? Heart, right? Yeah, exactly. So then the next most worst stroke would be a yang organ stroke, a bowel stroke. And what's the hallmark of that stroke? Is that your bowels are in a state of excess, right? So that's when that opening up the yang ming really works. And that's the most common presentation of stroke. Then the next one, milder from a yang organ stroke, is a channel stroke, right? So channel stroke has paralysis, but the Qi machine is relatively okay. So, my Chinese is not great, but it's adequate for talking with my patients if they speak Mandarin anyway. And so I can't tell you how many times I've had the conversation, you're still pooping okay? Oh, that's such great news. I'm really glad, like those words I know how to say, congratulations, you're pooping well. Because it means that your Qi machine isn't sick, it's just your channels. And if your body is basically healthy and it rebuffed the injury that well, then it's a really good prognosis for your channels being able to heal, right? And then the mildest is where it's just the Luo, so that would be just sensory impairment or Bell's palsy. So like factoid, I have two factoids actually. One is that it is known within Western medicine that Bell's palsy is a risk factor for stroke. It is not known in God's name why, right? There's no concept of what the mechanism could be in Western medicine that connects having a viral infection in your facial nerve with having a blood clot in your brain, right? Those are two completely different Western phenomena. But in Chinese medicine, we're like, yeah, of course. And then similarly, when the blood clot, we didn't go into causes of stroke because we didn't have time, but when the stroke is caused by a blood clot, disproportionately, if the blood clot came from your heart versus coming from anywhere else, you lose your speech for no good reason that Western medicine understands. And we're like, oh, I know why. Those are my two factoids. So the healing happens. You should know more or less. You heal from the inside out. It's like the opposite of peeling an onion, right? So your Zong stroke recovers to the place where it's only a Fu stroke, and if you're really lucky, all the way to just a channel stroke, right? It's rare that somebody has a yin organ stroke and then is all the way just fine, unfortunately. But it gets better, right? So very typically, You start out with a young organ stroke, so your large intestine is in an uproar when you come into the hospital, and then with acupuncture treatment and physiotherapy and everything, you wind up with very mild channel deficits. If you come in with just a channel stroke, there's decent odds you can walk out relatively unimpaired. So does that make sense that you're kind of pushing, it's like you're pushing the illness from the depths out to the superficial where it can go away. So constipation, promote qi flow in the Yangming channel. And then from a kind of integrative point of view, we're stimulating vagus nerve points and parasympathetic activation. So again, if there were a fire drill and all you knew was that treatment principle, you could go out and execute it, right? I don't know, I don't need to tell you where the big points on the Yangming channels are, right? It's, stomach 36. I happen to also really like stomach 31 and 41 because that's the kind of chain and lock for the whole leg, and why not free up the whole leg Yangming channel since you know that they're going to need leg rehabilitation anyway. That's kind of a multitask. But promote qi flow in the Yangming, right? Li4, I cannot think of a stroke patient in recent memory who hasn't gotten Li4. And vagus points, right? Point 0 is strong for stimulating the vagus nerve, PC6, stomach 36. And parasympathetic, right? So that's your sympathetic. So I put the Ju middle and lower jiao points in parentheses just because, to be honest, I don't usually use them for that. You absolutely could. Right? You could do scalp massage on that if you weren't able to do needles. It's just not what I happen to use. Auricular constipation points, sympathetic, 0, spleen, large intestine, and whatever other Zongfu is going on. Really use it as a tool. Body needles, Li411, lung 7, right? So that's that teapot where you take the lid off the teapot and then it pours better so that there's not a, it also promotes downward movement because the lung qi flows downward. Stomach 36 and 40, especially if there's phlegm, right? But even independently, stomach 40 is a good vagus stimulation point. Stomach 25 and 26, and actually I will, if the constipation's really refractory, I'll do e-stim across from 26 to 26. Raise your hand if you learned not to cross the midline in school, right? So when we say don't cross the midline, what do we really mean? Do we mean don't cross the imaginary midline of the human being, or do we mean don't cross the brain, don't cross the spinal cord, and don't cross the heart, right? So that's what we mean by don't cross the midline. So I actually routinely will do kidney 7 to kidney 7 for incontinence, as we'll see in a minute. I quite often do spleen 6 to spleen 6 for dilation in pregnant people. I have a colleague who does spleen 6 to spleen 6 and Li4 to Li4. You couldn't pay me to do Li4 to Li4, right? It goes right across the heart. Like, she says her patients don't die of heart attacks, and I believe her, but you still couldn't pay me to do it. But stomach to 26 to 26 is well, like, here's my spinal cord, here's my stomach 26, right? It's fine. Do I hear anybody thinking, why not spleen 15? Spleen 15 is so much better for constipation. Why not spleen 15? Because spleen 15 is right over the large intestine, and these patients are so impacted that I do not feel comfortable needling right over the large intestine because I do not want a needle through the wall of the large intestine and into a bunch of poop, right? That's a really good way to give someone a horrible infection. So I go on the stomach channel instead, where I know the large intestine is not, and then I run the e-stim there. So now that you have the information that you have to be really careful about not needling into the large intestine, like go ahead and needle spleen 15, just do it really carefully, right? Like I'm not actually telling you not to, I'm just not writing down that you should, because I don't want anybody running out and doing that without being really careful, okay? Yeah, people's abdomens get so distended. You don't even want to think about it too much. Okay, where are we? So conservation of on food, E-stim if it's refractory. Triple heater 6 for obvious reasons. GB41 opens up dye, right? Kidney 3 and 4, you'll palpate. Sometimes you'll just see they're like cratered in, they're so deficient. Spleen 6, liver 3 and 8. I love liver. Like very often the flesh of a stroke patient, it just has this dry quality to it, and so liver 3 and 8 is my like try to pump blood into that kind of, and obviously that's not just for stroke patients, that's for all our elderly patients, and PC6. So we already talked about this abdominal round rubbing. Again, I can't recommend it enough as a thing to give the family to do when they want something to do visiting with the patient, and if possible a thing to give the patient to do as a way of feeling good about taking care of themselves. Hip rocking, so that's just a twina where if they're lying on their side, you jiggle their hips so that the whole body kind of jiggles. It feels really nice. It's one of my favorite twina interventions. And then back shoe points, because the back shoe have this nice descending function as well as calming the person, right? So they're great for constipation and great for nourishing. So that's constipation. Any questions on that? No, okay. So urinary retention, super common, right? So you want to free the urinary bladder flow and stimulate the sacral nerve. So with scalp, I'll do 3 needles going forward at do 20. Why do 20? Because in our Dr. Ju model, do 20 is the down there models right onto do 20. And again, it works a little better if they're tender, and if the tenderness is a little forward of do 20, you saw that person's kind of crotchular area was a little forward of do 20, so go ahead and palpate around forward, and if it, like more like 20 and a half or 21 seems like right to you, then needle that. The Ju lower jiao points, which again, I should have done that. Whole lower jiao is forward of do 20. Sympathetic and urinary bladder, again, because there's this like startle reflex that's tightening everything up and you want to loosen it. And then Ren 3, 5, and 9, I find is a combination that helps to loosen the hold. And then kidney 7, E-stim. So the sacral nerve is in charge of holding in poop and letting go of pee. So to stimulate the sacral nerve, I'll do it for fecal incontinence and urinary retention. And the sacral nerve is connected down here to the tibial nerve. So there's actually, of all the things we do for stroke patients, this particular intervention has by far the strongest rating of a study, because they did rather a large randomized controlled trial, 2 of them, I think, of just doing E-stim on, but they didn't call it acupuncture E-stim, of course. They called it electrical stimulation of tibial nerve points. And on that basis, it was published in the journals and wasn't decried as witchcraft and any of that, right? It was just real medicine. So if we want to dabble in practicing real medicine, then we can e-stim the sacral nerve. But it works really well. I do it in spinal injury. I do it in all kinds of situations, MS, anything where the reflex to hold in the poop or to let go of the pee is not working as well as it could. So that's kidney 7 e-stim. And then depending on if the patient has any cold signs at all, then warming up their dantian works really well. So in the hospital where we have those physiotherapy heating pads, there's actually one that's designed for the lumbars. That's just a big square, and then there's one designed for the neck that looks like, a whiplash collar, and it goes down to cover D14 in the back. So that's perfect for covering the dantian. Or you could just take 2 regular heating pads, right, from a drugstore, and put one in the back and one in the front, and just warm the person to their core. Now, if their problem is heat, then this obviously isn't the treatment. But a fair amount of the time, the person is constipated and cold. I think we by far underdiagnose as a profession when patients are actually constipated due to qi deficiency or yang deficiency, right? It's easy to say, oh, well, the poop is dry, it must be hot, but that's really not necessarily the case. Of course, if the stool is staying in the large intestine too long, it's going to be dry no matter what their constitution is. So the dryness of the stool is no longer a relevant constitutional diagnostic datum, right? Does that make sense? Yeah, okay, good. I'm sure you knew that already. The kidney 7, warming, and then this hop rocking, hip rocking. Again, it works really well. If you can't, the best way to get the chi machine moving is to walk, right? We're a self-cleaning up, and if we can't walk to stir our chi machine, then the next best thing is to have like rocking twain, shaking, rocking movement, like that. Okay, urinary incontinence. So obviously raise the chi, strengthen the kidney, right? So we're doing the same points as for urinary retention, but we're doing opposite stimulation, right? We're nourishing those points instead of dispersing them. And then we're doing the supplementing points on the abdomen. Notice that Ren 9 is applicable in both cases because it just regulates the waterways. It doesn't tell them what to do. It just tells them to straighten up and fly right. And then I'm a big fan of kidney 3. And then also teaching the family that chafing, right? That kidney channel chafing that we did before. You just chafe from all the way from kidney 1 up to kidney 7 and 8. You just chafe the foot like this, and quite fast if you're warming them up. Again, the dantian warming works really well for incontinence. Hip rocking and shoe points as indicated. Fecal incontinence, same thing about raising the chi and strengthening the kidney, and then also stimulating that sacral nerve. So point 0, right, to center them, and spleen. And then kidney 7 with supplementing qi and yang, however you do that. Obviously, if you could do moxa, that would be great. I can only wish for doing herbs in the hospital, but, alas. And then urinary tract infection is super common in stroke patients, right, because of the urinary retention. And it's it's a 6 in one, half a dozen the other, right? If they leave the catheter in, then they're not training them to go to the bathroom themselves, and there's more of a risk of infection from the thing staying in. But if you're taking it out and putting it in and taking it out and putting it in, that's not that great either. So either way, there's a high risk of infection, and we need to know that in the elderly, urinary tract infection does not always present with painful urination, nor with heat signs, right? It's fairly often cold and asymptomatic in the elderly. As far as urinary symptoms go, has anyone lived through this with an elder? Does anyone know what the most common sign of urinary tract infection is? Exactly, yeah, confusion. And why? Well, because the small intestine connects to the heart, right? That's easy. The bladder, the small intestine, the heart. That's really so if your person is making good progress and then takes a dip in cognitive, immediately suspect urinary retention, and pulse is actually pretty diagnostic for this, right? The kidney pulse is usually the deepest, weakest pulse, and if it's not, chances are pretty decent there's an infection in there. And then you can even feel, like sometimes you're like, oh, how great, the kidney pulse came up. Wait a minute. And there's just this kind of yucky pathological feel to the pulse in there. And so that leads you to suspect UTI as well. Obviously, if there's any odor to the urine, but it doesn't hurt to warm up somebody's dantian, right? It does not hurt to put a heating pad behind them and one in front of them. So if they're cold and being catheterized, particularly if they're a man, because it's more, there's more area to get hurt and infected with a man being catheterized, go ahead and warm up their back and front. And if they're in the hospital and they won't let you bring in heating pads, then you would be amazed how much warmth your hands make. You put a hand kind of behind their sacrum and a hand right at Ren 2 here, and you just hang out. And if we had a little more time, I would make you do it on each other because it feels really nice. It's also great when people are frightened, right? If somebody's not verbal and they're anxious, just hang out with them by holding their dantian, and it's so calming. I do it all the time in labor, of course, when people are a little freaked out. Babies love it. They go boo boo between the heads. So yeah, the warming is really important for cold type UTI, which is a lot of them. The lower jiao points, again, back here. So you just palpate around for tenderness, and you may sometimes find tenderness in the front as well for UTI. If it's heat, then you can vent that heat pretty nicely by just doing a little bit of bleeding at ear apex. I actually don't bleed ear apex itself. I look for venules near ear apex, which if there is heat, there will be. And you alcohol it well, and then stick a lancet into a couple of them, and then alcohol it again so some blood can go freely. And that lets out a lot of heat quite quickly. And they're not sitting around with needles, so nobody knows you did it. So very important to differentiate cold, heat, and damp, right? So cold type, warm them with hot packer hands. Supplement yang and qi. If it's heat, clear heat from liver and or kidney, kidney 2, liver 2 and 3. GB34 is key because it has such a relationship with down here, and then Ren 3, 5, and 9 again. Or again, whatever you do for UTI is fine. Bring qi to the area by holding the front and back like a tai chi ball. Because there's usually if my immune system were fantastic, then they could catheterize me. And, they're using pretty good clean techniques, so hopefully it wouldn't be too bad. But the more deficient the patient is, the more likely they're going to get chronic UTIs from being catheterized. And then phlegm harassing the lung. So not only are my fluids congested, but also I'm inadvertently aspirating fluid because my swallowing doesn't work very well. So the upper jiao point. So up in here, right, that chest, where's my clicker? There we go. So up in here, so what's that? You'd call that do 22-ish, but you just palpate, and it should feel a little yucky under your fingers and or be tender in the person. And for that one, you can do kind of one on the center line and one each parallel. So those are the Ju points. More often I use body points, lung, large intestine, spleen here for the ear points. Ren 17 is great. I have to say I don't love using lung 1 in the hospital. You know, when you hear this like horrible rattly cough, it makes you itch to do lung 1, but as you inhale, you can draw the needles in, and I've just had needles move too much on me, even though you needle them outward. And especially in the, when I don't know the patients, if they have asthma or COPD or something, then their lungs will be very close to the surface. Lungs get extremely close to the surface in chronic lung problem patients. And if I don't happen to know that, and I go my merry way and do what I do, so REN 17 is almost as good as lung 1 for clearing the chest. It's more supplementing in nature, and there is zero possibility of injuring their lungs because there's that nice big sternum there. So I just use that one out of habit by preference. I thread it down with a 1-inch needle, and then you can stimulate it nice and strongly and get plenty of chi. Lung 5, if it's, hot and gloppy. Lung 7, if it's clear and watery. Li4 and 11, if it's hot. Probably Li4 anyway. I use Li4 not just to disperse, but I also use it to supplement or even technique, right? Because it's such a harmonious point for everything that's going on with stroke patients. Stomach 36 to nourish chi, 40 to clear phlegm, and then spleen 3 to nourish the spleen. And then percussion at the back shoe points. And I open the shoulders, right? You do whatever Tway Na you do, and you can really free up the lungs and get their chi moving better by doing massage all around the chest and shoulders. Okay? Any questions on this? How are we doing for time? Okay. Constitutional imbalances. So this is a little more straightforward because I'm basically going to say treat what you see, but here's what you're likely to see. The most common types, at least that I see in New York City, phlegm heat with liver chi, right, liver chi stagnation, liver yang rising because either the yin or the blood are deficient and not holding it down. And then there's this kind of gloppy phlegm damp presentation, which you sort of can see from the door because the person's pale, they look like they might have congestive heart failure, they have edematous ankles. There's clear, again, you almost think of like in stroke patient, in these phlegm heat patients, that they're globs of phlegm that the heat sent pushing up. And in liver yang rising, the chi exploded up. And in these phlegm damp patients, it just kind of bubbled up. Nothing pushed it. It's just the rising water level. So your main differential diagnosis is is there still wind? How much phlegm versus how much blood? And then what's deficient that I need to supplement? Does that make sense? So in terms is there wind? Is a binary, and if there is wind, I like GB20, stomach 31, right? That's my usual calm wind module. 0.0, whatever you do to sort of calm down wind, liver 3 through to kidney 1. And then you've done that. Usually there's not. So now, okay, in terms of excess, there's something excess because there's stroke there that doesn't belong, right? There's blood in the brain that doesn't belong there. So even if it was a hemorrhagic stroke due to terrible chi deficiency not holding the blood, still now you have a wet spill in aisle 4. You have blood lying there that doesn't belong there. So you need to get rid of that, but it might be just that, it might be just blood, or there might be just a mountain of phlegm that's also up there clogging the brain, clogging the orifices, right? The more they have hyperlipidemia, the more that's phlegm, right? And then what's deficient? Underline, well, the pulse, the tongue, palpation, history will tell you what's underlying. If they have, chronic urinary problems, if they have, kidney diagnosis, glomerulonephritis history, okay, it's a kidney problem, right? If they so you can sometimes kind of guesstimate it, and their pulse tells you pretty reliably. Actually, the great thing about treating stroke patients is that their pulses and tones are not subtle, right? It's good for learning on beginners, and they really tell you what they need, right? It'll be like scrawny kidney pulse, huge pounding liver pulse, completely empty heart pulse. You're like, okay, energy's not reaching their heart, because they have this huge exploding liver. They tell you what they need. For scalp, adjacent points over lesion. So again, just find out, again, this is the kind of thing we'll have a little more time to do in a weekend kind of class, but if they tell you, do we have a picture of the brain here? So the three main territories of the brain: anterior cerebral artery. Does this remind you of any structures you ever learned about in school? Bladder channel, right? Middle cerebral artery, right? So similar to the gallbladder territory. And then the posterior cerebral artery. Those strokes are more severe. They involve the pons or the brainstem or the cerebellum. I'm going to needle kidney and do and ren to treat those, right? They're bad. They're in the back. They're more severe. So it's pretty simple. Anterior, middle, and posterior are the main major vessels. Or you can ask, if it's a loved one, you can find out where the lesion is and do the appropriate channel. And you can scrub, you can do scalp massage, you can do tapping, whatever you need to do just to bring some chi there, and then also stimulate distal points. Okay, was that where we were? Yeah, adjacent points over the lesion. Zongfu points as indicated, right? And then just little tricks. This is a stomach 2 for wind, is a Shi Shui Min trick. I've tried it. I'm not sure I think it's miraculous, but it's cool, and I do think it helps sometime. So you needle it. You don't needle it into the foramen like we learned in school. You needle it straight down the channel. And I practiced on ear needles for a while before graduating to 1-inch needles, which is what he says to do. Narrow gauge, obviously. And especially if the wind is in the head, if they're having tics or something, it can be useful. But again, I tend to use larger like tried and true points with stroke patients because I don't want to be nervous about doing some new thing. So GB20, like a good deep GB20, GB31, and liver 3 through to kidney 1. That's my, there's wind protocol. Circulate the chi, transform phlegm. Did I miss out on a... There we go. I don't know how we missed this. So this is the balance. Anyone here use the balance method? Ever? Anyone hear of it? Yeah. Use it for pain or, yeah. And yeah, so it's great for pain. It's also, so I literally, I went to a seminar of Dr. Tan's when he was still alive. And after class, I said to him, okay, so it looks like a really great way to circulate the chi, but all of my patients are so phlegmy. Is it really going to work? Should I do something different? And what he said was, no, this alternation yin-yang pattern, right? So if the right blue is yin and red is yang, so if my right leg has yin points and my left arm have yin points, and then I have yang points here and yang points here, so I'll do it like this. It pinwheels the chi, he said, and by pinwheeling the chi, you also circulate the fluids, and the architecture of the treatment transforms phlegm, right? You don't just need the points to send magic signals to the body to transform phlegm. The actual physical movement of the treatment is transforming the phlegm. And so that was, you have your little watersheds in your practice, and that was one for me, I have to say. I think my results really improved, especially with those phlegmy patients. And it's often the case when you have a patient who doesn't have so much qi, you don't get a lot of magnificent treatment effect from choosing one specific point. It's more like with a baby, you're needling regions. And so just doing shoestream and chussi, Yuensaris and chussi, of those, that's kind of his generic treatment. And then if you have a reason to substitute a different point, great, substitute a different point. So a really typical stroke patient for me is I'll start with the affected arm, which is the key, most important thing I'm trying to do at the time. So large intestine 4, 11, and 15. And then I'll add in as a bonus triple heater 6, even though I'm mainly doing Yang Ming points. I could even add Baxia. Then the next thing I do is I go over and needle Yang points on the opposite leg. Oh, so we'll do it this way. So I'll do stomach 36 and 40, and then again throw in these bonus Xiaoyang points. So now I have predominantly Yang Ming with a little bit of Xiaoyang going there. So what's the next polarity I needle? It's this other leg, which if I've been doing Yang Ming, what am I going to do? I'm going to do Tai Yin. So you get a Yang Ming Tai Yin circuit, just the same way you might do Du points, Ren points, right? It's that same kind of figure 8. So I'll do spleen 6 and 10. And then I'll talk about it later, but a deep, strong spleen 6 circulates blood stasis really well. And then I'll finish up with PC 5 and 6, which it's actually Jui Yin, which matches the Xiaoyang points I've been doing. But as it happens, the pericardium has a really strong relationship with the stomach. I could also needle a lung point, right, a Tai Yin point to tie it in there, but I don't necessarily need to. So that's how I use it for stroke, but the general idea of a balanced treatment is that you do the whole sort of 2 sisters married 2 brothers, you do the whole quadrant. You do Yang Ming, Tai Yin, or Taiyang, Xiaoyin. You do you circuit the whole thing, and then you can introduce variations on top of that. If you're treating an injury, you can actually avoid needling the injured limb so that you can do manual therapy on it while the person is resting with the needles, or so that the person can move the area while they're resting with needles. So it's a very versatile way of treating. And for me, if the patient's qi is in good enough shape to understand a treatment like this, then that's what I use. So if the patient has a really bad stroke, a Zong stroke, they're cognitively impaired, they can't talk, I tend to use a simpler bilateral treatment, like I'm talking slower and more clearly, right? But if they have a bowel stroke and their qi machine is obstructed, they're not as nearly as sick, right? They're in better shape, so I use this treatment to circulate their fluids. And by using not even just the Yang Ming Tai Yin circuit, but by adding in those Jui Yin points and Xiaoyang points, I feel like I even still turn up the volume. So I'm asking this to circulate not only qi and fluids, which are kind of the province of the Yang Ming Tai Yin circuit, but also the blood, which is the province of the Jui Yin Xiaoyang circuit, right? That makes sense? Yeah. So if your patient had a big yin-yang imbalance, then Taiyang Xiaoyin would be in order, but that's not usually what is bothering our stroke patients. Was that clear about the balance treatment? You all get the, okay, I strongly recommend trying it. in your practice because it works really well, both for pain and also for congested fluids. Okay. So here's our balanced treatment. I'm pretty sure this is almost the same treatment I said. Oh no, so here in that sample treatment, I did what I do when both chi and blood need moving. Here I broke out more circulate chi, more circulate blood, right? And so again, stroke patients come on a spectrum from it's all about the blood stasis to it's all about the chi, all about the congested fluids. So you can decide where your patient lives on that spectrum and add and subtract points accordingly, okay? So that's almost kind of the key. Once we're out of the first 10 days, this is my key stroke treatment. Because guess what? Remember how I was saying about the Ju and the Jiao are alternate side of the scalp treatments, so you can alternate them well. If you're doing the yin points today and yang points tomorrow, you can equally alternate the treatments so that no one set of points gets tired. I think in China, where they do more or less, a lot of places, I don't want to generalize too much, where they do these point protocols on the same points every day, I think those points get tired. Like, I think you really need to switch it up. It's important to me to do that. Okay. And then round rubbing. I think I didn't talk about round rubbing on the shoe points. So what time is, I think we have time. Turn around to your neighbor and turn to them so that you can just do that, right? With your arm like that. And so choose, either do, my favorite is to get my blood shoe points, right? So right behind the liver. But if you have kidney deficiency, you might choose to do the kidney shoe points. And so if you don't, come on, each other. So and the reason for it is because it's shockingly effective. So one of you, the giver, has to turn around sideways. So the optimal body mechanics are to be sideways to the person. Yeah, I see some people kneeling, I see some people turning around, yeah. And try get the movement, and it's kind of go over the top and back towards yourself. So you don't go this way. It doesn't matter whether it's clockwise or counterclockwise. The important thing is you go out your Yunlin channel, right? So, yeah, other way. Yeah, good. Out the top. And slow down a little. And doesn't that feel really nice? So I know this is England and we don't touch each other and everything, but it just, so take 30 seconds and switch. And it just I'll try a little on the blood points. So I do this in birth all the time. It relaxes the liver, right? And at any given time, your liver is holding on to a lot of your body's blood supply. And if you relax it and relax the diaphragm, the person can just be so much more relaxed. So if you haven't switched, switch. I just want everyone to know how nice that feels. Doesn't that feel nice? It feels really nice. Okay, so I'm going to motor through the next few. So the key thing you go ahead and keep rubbing each other. That's fine. The key thing about treating the functional deficits, right? We've moved from stroke recovery to stroke rehabilitation. Is that you can't treat everything. Like, unless it was a very mild stroke indeed, the patient is going to present with 10 different functional deficits, and how do you choose what to treat first? So in extensive discussion with the rehabilitation staff, and for a long time my office was right in the same room with the rehab doctor, so I really feel good about this component of developing the stroke manual, which was where to start. So where to start? First, find the patient, right? Is the patient in the room with you, right? So if they're nonverbal, try and make sure that you're in touch with your, wink at them, make little nonverbal jokes, like do something silly and see if they laugh, right? There are lots of ways to just test the you're testing your bandwidth. First you get connection, and then you're like, okay, can I upload a small file? Okay, let's try a slightly larger file. Can they recognize their family? Can you get a reliable yes and no? And speech, we talked about this. Aphasia versus dysarthria. And then freeing up the window of the sky point's never a bad idea. If you're not sure what to do with your stroke patient, just massage their neck and shoulders, like do round rubbing on their kidney and liver shoe points, and check for, there's this tightness you can feel in the hypoglossal muscles, and you can just do little, the less is more with movement here. It's like you can do tiny little circles. The main thing is to have a healing hand, just to communicate relaxation and unconditional positive regard with your hands, just to say hi, I'm here to help, what can I do? I'm sorry you're hurting. So then do 15 is really good for aphasia. I needle it in and out, right? I'm way too risk averse to leave it hanging around there. I just in and out it. And heart 5, but it's really this nervy cleft heart 5, deep in with strong stimulation. That's kind of our key intervention in bold. Do 20 and 24, of course. Ren 23, of course. Address the constitution, of course. Plus, very often there's phlegm, and PC5 is really good for, misted orifices. Kidney 2, if it's the heart fire blazing thing. It's easier to do heart 8 and PC8 on their affected side because they can't, get away from you. And pretty often the sensation on the affected side is poor. So I'm not just being mean. It's a really good sign when your patient starts to get cranky and needle sensitive. It means that the sensation is coming back and their kind of their wei qi is coming back online and patrolling the perimeter, and when they start hating the needling, which they didn't before. So be kind with that, because it is a good sign. It happens pretty often. But yeah, when they're sacked out, there's no reason you can't do heart 8, PC8 if they're indicated. And then for the speech, you can do this lower 1/5 of the motor and sensory line. And indeed, what's good about it is that it's also over Broca's area. So it both is the physical infrastructure you would use to make your words, and also it helps get them out of the brain. The downside of that is that it doesn't combine well with therapy because it hurts. It's a good idea. I often will do the Jew points while they're doing their therapy, but you can't do that so well with these because it's the muscles they need to move. So I'll do more do 23 and 24 Jew head and face. And then heart 5 and by 6X, I mean a low location of kidney 6, which is, more talks to the extra vessel. Kidney 4, also swallowing points. So these swallowing points are key. GB 12 and 20, triple heater 17. And then what I mean by outer jin yu is newsflash. You don't have to you can actually just reach the same point from outside. So palpate your chin, and in your hypoglossal muscles is a little kind of cleft that's a little tender. And right there, if you needle towards the base of the tongue, you will get amazing qi at jin yu and it didn't have to go through their mouth, which is awesome. I often kind of turn up the volume on this treatment by adding a point in the middle, also right towards the base of the tongue. And then I use these 3 points also for brainstem injury, but I just point them back towards the brainstem. And so that combination, can you see how if you do that, you're just drawing this circle around this interface between the base of the brain and the throat, right around so I often will just do this when I'm stuck in a case and I'm just not sure what needs to move, but something does. This is a great treatment. Actually comes right from the Junjio Dachang. I learned it from Shui Min, and I figured it was a Shui Min treatment, but then one time I was reading the Junjio Dachang, and it's right in there, this combination. And if you're tight for needles, you can just thread GB 12 to 20. You don't have to do both. And then the same opening up the sky window areas. We talked about this a little, so I'm not going to go over it too much. Start with balance and trunk stability because it's more important. You don't want an unstable person trying to walk. You want to really dial in their balance and trunk stability. So body points, this same swallowing treatment. I'm saying I love it so much. You can also try it for balance and trunk stability. The jiao balance points, they're over the cerebellum, which makes perfect sense, right? Because the cerebellum is in charge of balance, and do 20. I supplement daimai, right? So I supplement GB41 and GB31 and 26 bilaterally. And I supplement DU4 and REN4, so it's like you're strengthening the flower pot that they're held in. During therapy, the upper fifth of them, that's the leg. Okay, so for Twaina, lower extremity, liver, and gallbladder channels, and the lumbus and the gluteus stabilize the patient. For lower extremity, I love to just have this upper fifth of the motor line in during therapy. It just seems to help the physical therapist do whatever they do. So if you've got, mom at home and you've got a visiting PT, just inform the PT that they're going to do their work with these needles in, because it works way better. They'll be excited about it. For early motor return, this is kind of the key that opens up the channel, GB30 and UB40 with the real, again, this is a Shui Min thing, and he has this kind of vitalizing needle technique. If the limb is weak, then stomach 31, 36, 41, supplementing. And we talked about that foot drop, either Twaina, chafing the stomach line, or that E-stim, where you're doing both trigger points in the tibialis anterior and also the motor line at the same time to make it twitch. Spleen 6, if you do it kind of posteriorly, with a rather long needle, 2 inches, behind the tibia, and then stimulate really strongly, that opens up the luo, moves blood stasis in the whole lower body. And then for a stiff ankle, just needle GB40 through to kidney 6. It's not the easiest through and through to do, and it's actually really harder when someone's got a stiff ankle. So much more often I'll just do 2 needles towards each other, but it does work really well. Or you can do E-stim, and then you do rotating of the leg. And then upper extremity is our last thing. In middle cerebral artery stroke, the arm lags way behind the leg, and it may not return at all. And then also there's this pain thing going on. So that's the second 2/5 of the motor line. If there's a sensory deficit, you can also do the sensory line, or you can needle from motor to sensory and stimulate them both. So instead of having the needles go down along the line, you can have them go posteriorly between the 2 lines. And then these key points, heart 1, which you either can needle right into the armpit, or you can do what I do and needle it from Jianqian. Lung 5, large intestine 4, 11, and 15. And then we talked before about doing either Sanja 5 or 9, finding a motor point here, and doing the Bashya. The Bashya are usually really easy to do on stroke patients because of the atrophy. So you can get all the way in, but also if you don't like to kneel through the joint capsule, you can also just go in at the top here and then pop in an extra needle here. We talked about so if the patient's weak, just use large intestine 10 instead. During OT, use the shoulder line. For biceps return, Jianqian and then lung 3 really breaks up spasticity. triceps return, SI 8.5, and SI 9, and then the third fifth of the motor line. Wrist extension, you get that one that focuses on the hand, and you do these at the same time so that you're twitching the hand. And then the Dr. Ju shoulder area we already talked about before the break. Okay, so I think that's how far we're going to get. I already mentioned the alternate location for Heart 1. We talked about spleen 6, and we talked about Heart 6. So it's been a pleasure talking with you. I'm sorry we don't have more time, but there is that weekend coming up. And if you are treating stroke patients and want to have a Google group or something to work with, I'd be delighted to set that up. Oh, we've got a place to sign up if you want to be on a mailing list for either of those two things. So it's next November 9th. And anyway, lovely to spend the day with you all, and see you around later. Take care. Thank you very much for your time.